Good morning and welcome to the Cumberland County Board of Commissioners regular agenda session meeting for May 9th, 2024. At this time, I'm going to call on Commissioner Fairclough for the invocation and pledge.
Stand, honor God and country, please. Father, once again, we come into the presence of our citizens and you, and we ask that the decisions that we make be pleasing in both of your sights. And these things we ask in your name. Amen. Amen. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Chairman Adams will be here shortly, and I believe as well as Commissioner Council. At this time, I will take approval of the agenda.
move to approve the agenda as presented unless there's any changes by the county manager.
County manager.
Good afternoon, everyone. One addition, we do need to have a closed session related to paragraph 143-318-11, paragraph 5.
And what is that for, sir?
Two contracts.
Okay. I wasn't familiar with the statute, that's fine.
Okay.
All right, with that addition, I then will move to approve the agenda. Second motion.
Yes, been moved and properly second. All those in favor?
Unanimous.
Thank you. We will now move on to consideration of agenda items. Manager Greer.
Yes, as a first agenda item is a resolution authorizing the expenditure of opioid settlement funds. The associated budget amendment was already approved in a prior meeting. Dr. Jennifer Green, Public Health Director, will present this item and answer any questions that you may have.
Thank you. Good afternoon, Dr. Green.
Good afternoon. Good afternoon, Commissioners. Today we're here to present a consideration for the agenda session regarding our opioid settlement funds and specifically the early intervention option under option A. As you know, the county is set to get $30 million, almost $31 million over 18 years in opioid settlement funds. Back in the early part of the year, the commissioners approved the utilization of up to $500,000 of settlement dollars to initiate an RFP process. I'll note that this is the second time that we initiated the RFP process. The first time, we did not get any proposals regarding early intervention, so in our second go-round, we did receive several proposals for early intervention. We convened a multi-sector panel to review and score those applications. And I'll remind everybody about what the definition of early intervention is. These are programs and services that are specifically targeted towards adolescents or youth that already have problematic substance use or mental health conditions. And these could fund or support programs such as mental health first aid for young people, a peer program for them, or other types of approaches that target their parents, their caregivers, a neighbor, a friend, or other professionals. And in short, they're programs that will help to fund identifying youth that have substance use issues and then to help get them the help that they need. So the panel met and reviewed and is recommending two entities get funding. The first is Camp Rockfish Recovery and Retreat, where the committee is recommending that they receive $97,149 to initiate a summer day camp called Camp Heal. It is targeted towards two schools, specifically the children and teens that attend those schools, and identifying those students that have problematic substance use. They'll provide, during this camp, they will provide two different evidence-based substance use prevention curriculum. They'll do naloxone training for these young people. They'll do some mindfulness activities, new idea around green time, so we know what screen time is. Green time is getting the kids outdoors, out in the play space, outdoors so that they can interact. And then they'll also host several different Saturday events, family engagement events that are focused on the parent parent portion of that, so engaging with the parents around opioid use disorder. And this is our first collaboration with our settlement dollars around the faith community. We have not previously funded anybody in the faith community, and in our needs assessment, that was identified as a key partner.
We got a question
Yes.
from Commissioner Booth.
Just ballpark, I know they're not going to know until they actually put it out there, but they have any idea of how long the camp is going to be and how many this has the potential children or youth to reach?
Yes, so it's a two-week summer camp, and they'll hold it each summer of the funding year. And then in addition, they'll do these Saturdays events. They're expecting about 40 or 50 kids per Saturday event, and then up to 100 kids or so with the day camp.
Thank you.
Commissioner Keith, I'm coming to you.
Okay. So a total of, we're hoping to have 100 kids?
Plus the Saturday events. So those will be different kids.
Everything on there is that.
Okay. I'm a little perplexed at the title of the slide.
Yes.
Recovery and retreat. Is this only open for, I got the slide before, they talked about adolescents and family members. But is it only adolescents and family members of individuals who are in recovery?
Not only in recovery, but the youth do have to have some kind of mental health or problematic substance use identified already to qualify for an early intervention strategy.
Why?
Because
Why is it limited to just families of addicts?
So under option A, that's what early intervention is defined as. So this is the language that is in the MOA, and so it has to be for families, or it could be their caregiver, it could be a teacher, it could be a social worker, it could be anybody, but it has to, the target of early intervention is identifying who those young people are and then intervening early before the substance use becomes an addiction or becomes a substance use disorder. So it might be, it doesn't necessarily have to be opioids, it could be any kind of problematic use of drugs.
I'm trying to back into this, and it's, and Jennifer, I know you don't make the rules, okay? Public record, whatever, Jennifer doesn't make the rules. But the whole idea behind the education was to educate in the school system, hopefully, to do this. And if we were able to get into the school system, everybody could be educated, and we wouldn't have to put on these special programs and Saturdays and all this stuff if we could just be part of this option B. And
We talked about that.
yeah, and I'm just wondering if we're not targeting, opioids affect everybody. They do. They don't just affect the kids of addicts. So, go ahead.
No, I think this is where we got into it the other day, which is why we did the ARPA funding for the schools. And in order to use this, we'd have had to do, and we just have to end up providing the information to go up under B as opposed to A. A was, because it's already best practices, is why this was done to get it there early.
Yes.
If we would go, because we talked about, you weren't there, but in our ARPA funds, we didn't have that restriction. So I feel your pain, but from Dr. Green and the committee, it is what the guidelines are set out from the settlement thing. So I think when I was making that big thing the other day, I guess it's a good thing we're using the ARPA funds to be ahead of that. That's the best I can,
If I can follow up,
and I'll come
if we go to option B, are we still under the same restriction?
So under option B, there's a couple of different strategies that you can do prevention, which is different than early intervention for a wider audience. So you can do that under option B.
we have to create it and show the best practice.
And to our, we went with option A because nobody had an option B set up at that, no county did. So this was the
And
way.
it had to be approved.
Right.
It has to be approved. We have to do a collaborative strategic planning process, and we did do a needs assessment, but we wanted to get our feet wet, do some things that we know that were on that shorter list of evidence-based strategies that we knew worked, that we could do some long-term and short-term planning, and then we can go to option B at any time and still do option A as well.
So I guess what you would want, Commissioner Keefe, is to possibly instruct the committee to start doing, to process under B, that education and that prevention.
Yes.
Let me go to Commissioner Jones, and then I'll come to the manager.
Good afternoon, Dr. Green. My question is,
Oh, wait a minute, let me do this then. If you got a new question, let me finish. I think he wanted to do on Commissioner Keefe, and I'll come right back to you.
I think when we first started the program, we chose option A, and then based on the conversation we had on Monday regarding ARP and using strategies B as option B, we've done most of the legwork for option B, so we could move the early intervention education program with the schools under option B. We just have to get it approved, but we've done most of the work. Same thing with this, we will go through and go back and look. We've done most of the work, and if it can go under option B, we'll put it under option B. We'll meet this Tuesday, and run through that. So if it goes through option B, then we'll bring it back and say, we got to approve, it's going through option B.
Well, there's really no reason to move this to B. I mean, it's the same money. So the other one is the one we want to do to B. I mean, let's not duplicate the work. Leave this in A. Don't try to get approval for this, because you can do this under A. So there's no reason to do that. What we did on Monday was to get approval, use the ARPA funds up until that point, and then do that under B.
I thought we had to do one or the other.
You can do both.
Commissioner Jones.
I was wondering, if I heard you correctly, you said that you're going to service 2 schools, correct? Is that correct?
That's the, Rockfish is focusing on 2 schools in Cumberland County Schools. That's where they're going to start. And then, of course, if there's space and time for other students, they can do that.
And which 2 schools would that be?
I don't have that off the top of my head for those schools, but there are 2 schools in the Southview District, I believe.
In Southview District?
Or the Southview area, yes.
And then will there be plans, is this the first time they're doing this? And the question was then will they hopefully be able to do this again next year?
So they have it for 2 summers, and then in addition to the Saturday events, and those Saturday events are open to not just those students at those schools, so it could be for any school.
In the Southview District?
Or any, there would be community
Anywhere
events.
throughout the
Any
county.
community event, yeah. Yes, sir.
So this is actually Camp Rockfish is running this program?
Yes, Camp Rockfish is running this program. And they're an established program already. They work with
Commissioner Bush used to go
the
to
community, and they do Faith in Action that happens on Thursdays.
Everybody did the Camp Rockfish. I went to Camp Rockfish.
And then the second entity is, the committee is recommending $350,000 for Mid-Carolina Regional Council. And this is a different focus, a little bit of a different approach, but will support those kinship caregivers. I think this is a missing piece that we haven't talked much about for our settlement dollars, is training the caregivers. We often have grandparents or foster parents or others that are caregiving for individuals impacted by opioid use that don't really know what to do. And so really focusing in on those parenting skills, mental health first aid for them, helping them identify when their youth are being impacted. They'll hire a peer support specialist, and then also do some naloxone education with them. So these 2 proposals really reflect a different approach than we've brought before the commissioners, other than some of our traditional partners that we funded in the past. We know that you all care about metrics, so we'll be tracking a number of metrics. So our youth will be tracking, of course, the number of participants, their outcomes. We really want to look at, one of the required metrics is to look at the short-term suspension rates, so people staying in school, how many people use the training, what skills they gained from the services. So in summary, we're requesting $97,149 for Camp Rockfish, and then $350,000 for Mid-Carolina. As the manager noted, you already approved a budget resolution for this, so we're requesting that there be the ordinance, or the local spending authorization for this be included in the meeting.
If I can get a motion for that item, if I can get a second.
Second.
It's been moved and second. All those in favor say aye. Oh, raise your hand. I forgot my hand now. Anybody else have any other questions? Dr. Green, thank your committee. I think we started early, and they do yeoman's work. At some point, we probably need to bring them in and thank them, because that's a lot of work. I see the meetings that they have about every week or every other week. They've been meeting a lot. But if you could take back to them, and so they could possibly look at it. I just saw the other day where Wake County is putting the locks on all around the communities, and I didn't know how they did that. Well, they had refrigerators. The manager kind of enlightened me. But if that's one of the things that we might be able to do, if your committee could talk about it, I'm not telling them to do it, for them to at least assess it.
Yes.
And then if they say no, that's fine. If they say yes, that's fine.
Yes, and we're in the process of reaching out to Wake County to get some of their best practices.
All right.
Yes, sir.
Thank you.
All right, thank you, Commissioners.
All right, that will take us to the contract for professional auditing service. Mr. Manager.
Yes, this is the annual contract that has to be approved by the board in the LGC. Brian Haney, interim finance director / ACM, will present this item and answer any questions you may have.
Cherry Becker.
Good afternoon.
Who'd you get?
Cherry Becker, we have a 3-year
Motion to
contract.
approve.
Is there a second?
I don't mean to cut you off, but they're very qualified. They've been around for a long time. They do. Is there anything other than just the contract?
No, it's the contract and the engagement letter. It's for the county as well as TDA. TDA is paid through their fund, but it's part of the same engagement letter.
After what we've been through
Yeah,
the last couple of years,
Yeah, them before
they
somebody else
seem to
does.
be a stable group for us. So I'd like to make a motion to approve, Mr. Chairman.
Moved in second. All those in favor? That's unanimous. He held his hand up in the kitchen. Intent to lease real property at 2210 Rich Walker Road. DOT has done some things.
Yes, Amanda Bader, General Manager of Natural Resources, will present this item, answer any questions you have. I think this is an annual.
This is every 5
Every
years.
5 years, I'm sorry.
I saw her kind of walking around lost, so I had to bring her in the room.
Thank you for that direction, Chairman. Good afternoon, Commissioners. This is about our lease for the Cooper container site located at 2210 Rich Walker Road in Fayetteville. That I just brought to you another lease agreement last month for J. Carter. This one will be for the Cooper site. We've got a little gap here. We had a little difficulty in communicating with the family. It's in an estate at this time. And so, or heirs, working with the heirs. So we're asking for the approval for a lease renewal for the Cooper container site. The terms are 5 years, $6,000, with an option to renew at the end of the lease period. We're asking for the chairman to execute the attached lease agreement that's been audited and determined to be legally sufficient. We're asking for this action on the May 20th agenda.
I can get a motion to approve?
Second.
It's been moved in second. All those in favor? That's unanimous. Thank you.
2D is ARP funding offer, asset management and financial plan for the Newcrest Water and Sewer District. Last week, we got a notification from DEQ. I don't know if it had anything to do with our meeting that we went up there. But they awarded us $400,000 and
Motion to accept. Motion to accept.
Second. Catch a check.
Yes, sir.
All those in favor? All right, thank you.
And next, we have item 2E, resolution to support the Cumberland County's fiscal year 2025 state legislative request. Sally Shutt, Assistant County Manager, will present the item.
You know that this is the biennium. They're not doing anything in biennium, but go right ahead. But all bills that had to be done last week. So
And we did email the delegation these requests
So y'all saw
earlier.
that?
This is just a
Right,
formality
she
for
sent it out to
resolution to follow up with them with this formal resolution.
if I can get a motion to approve.
Motion approved.
Is there a second? It's been moved and seconded. All those in favor? It's already gone.
Go ahead.
Bid award for the emergency, it's service chill. Which one is this? You might as well do all the chillers. Do all the chillers. Review all our chillers all the way around, Jermaine.
Yes, sir.
Which one is this?
This is for the Emergency Services Center.
Well, to the one that Bill says, I don't want on there, you're not gonna put it on it. Go ahead, I'm sorry.
We had to rebuild the 2 condenser pumps for the one at DSS and replace the battery.
And no cooling over there.
Jermaine, you kind of mumbled that last part.
We had to replace the battery. Yes.
You would have felt that problem. Solved it. He solved a problem. You can't ask for much more from the engineer than to solve a problem. That's right. So everybody in favor of the chiller, can I get a motion? Second. It's been moved and seconded for the chiller replacement. All those in favor? Unanimous. That is unanimous. Thank you, Mr. Walker. You still here for the S3P contract for design of the homeless support center?
Yes, this is the base contract, but then also it outlines the architect's responsibilities through all phases of design and construction. It covers also what we call Phase 1 activities, which is the kickoff through conceptual design, and it'll start with meeting with stakeholders where we can build out the building program, create the building program, and then come up with that initial cost estimate to bring back to the board. And we're just requesting that the board approve this contract and move it forward to the May 20th regular meeting as a consent item.
Is this the local firm?
This is the firm out of Wilmington.
Oh, out of Wilmington.
Yes, sir.
Who are the stakeholders?
Well, there was a committee that was mentioned, and however the board decides who those stakeholders are, those are the ones that we would engage.
The board, this board?
Yes.
Okay.
I think it's the one that she put together, and then last year when they did it and voted on it, and we just...
Let me say, this is going to be a big project, and you want to get it right. So if you bring all the stakeholders, they're all one individual thing, and this concept is so much more grand than just a typical day center or shelter. You know, it's an education center, so if you're the lead, Tony, just get as many stakeholders you can for success.
We have social workers on there, people obviously involved in the homeless community, a great group of people from different dynamics, which is, I think, what you're saying.
Well, I don't want to take up too much time. This is my concern. We're doing something different here. And if there is a perception of homelessness that homeless advocates have and other groups have, that they may not know what we're really trying to do here. So not is it you shouldn't get a homeless person on a homeless stakeholder policy is probably not the best thing, because they're in that position. Let's find success.
Well,
and
success.
have to get success. The education. Tony, I feel like I'm not stepping on you. I just wanted to be as successful as possible, and that means, hospital people.
Okay, all right. So this is the contract for the design. Yes, Commissioner Stewart.
Thank you. I absolutely understand what you're saying, but I don't want to just overlook somebody who's currently in homelessness, because who better us to tell you what they need than them? But also success stories. Not everybody is homeless for the same reason. And so we gotta have a variety of people from different walks of life and stakeholders to be able to.
As we get that, we'll make sure that the board has an opportunity to review and nominate. All those in favor of the contract for the design of homeless, I did, I'm the chair. All those, can I get a motion?
So moved, Mr. Chairman.
Is there a second?
Second.
It's been moved and second. All those in favor? All right, that's unanimous. Rate increase for the Kelly Hill Slocum Road sanitary sewer.
Yes, thank you. This is to cover the operational and maintenance costs required to operate the system. You have the attached rate structures, and what we're proposing is a rate increase from $6.95 to $7.99, which is $1.04 for the flat rate charge, and then from $50.36 to $57.91, which is a $7.55 increase. And we're proposing to increase these rates over 5% per year for the next 3 years. And we're looking to get this out to the customers on or about June 1st, so it can go into effect July.
I would, anybody have any questions on that? Because and you may not know, Jermaine, because you hadn't been involved, and I guess we need to have, make sure we have a good conversation, because as if this company comes, Project Arrow comes, and they're talking about PwC running water and sewer out there, is there a possibility, Mr. Manager, you can have that conversation that we get out of this water business out here and they can do this too? Because it's going to be right next door.
Same area.
It's almost on top of each other.
Yes.
All righty.
Should we delay any rate increases?
No, I wouldn't delay. I would keep moving forward because it's going to take a while. But I will say that PwC and myself have had those conversations about the future also.
Okay. If I can get a motion to approve? Second. It's been moved and properly second. All those in favor? Unanimous. That's unanimous. All right. Rate increase for Southwest Water District, Grays Creek Water and Sewer District.
Yeah, so once again, just to cover the operational and maintenance costs for that system as well. O&M fee increase of 43 cents, and then a flat rate charge for the water usage up to 2,000 gallons of $2.
If I can get a motion to approve.
So moved. Second.
It's been moved and properly second. All those in favor? Unanimous. All right. That takes us to the ARC Committee funding recommendation. The ARC Committee heard all of those the other day. He's just going to put those up there for you to be able to see.
I don't have a presentation.
Oh, you ain't got a presentation? Well, how they going to know what they we approving it?
I got a question. Who's on the committee?
Mr. Keith, Commissioner Keith chairs it, Commissioner Stewart, and myself.
Can you all agree?
Yes, it was unanimous.
That's enough for me.
All right. Is there a motion to approve those recommendations? Is there a second?
Second.
It's been moved and seconded to approve the ARC Committee funding recommendations. All of this stuff goes to, because it's all been unanimous, to the board meeting on the consent items. Are there any other items? Mr. Manager?
No, we do have to have a closed session, real quick closed session.
Anything else from any of the other commissioners? If not, monthly reports, does anybody have any questions? If it came to you in that PowerPoint, and so if without that, what kind of, is it for personnel, property, what? Contract. Motion to go into closed session for contract pursuant to the NCGS. It's been moved and seconded. We go into closed session. All those in favor? That is unanimous. And if I can get a motion to come out of closed session?
Motion to come out of closed session.
Second.
All those in favor? That is unanimous. Motion to adjourn?
So moved.
Second.
It's been moved and properly second. All those in favor?
Unanimous.
We are adjourned.